get this party started. My name is Elise. I'm the Manager of Member Engagement at the Tampa Bay Library Consortium, and we are so excited to have you here for our very first FHSLA and TBLC collaboration. This is an exciting new collaborative initiative between FHSLA and TBLC, and the purpose of this venture is to connect librarians throughout the state of Florida. And we're hoping to make these monthly webinar sessions, and from this point on, it should be the second Wednesday of the month, but stay tuned, that might have to change monthly. But be thinking of some ideas for future webinar sessions. So today's session is obviously going to focus on COVID-19. We want to use this opportunity to review key COVID-19 health-focused resources freely available to all. And during the session, feel free to ask questions in the chat box and share your experiences. And hopefully we'll have a little time at the end for some Q&A as well. And we have a very impressive crew here with us today. We have Tara Brigham, Mary Catherine Haver, Angela Novak, Artis Hansen, and Jorge Perez. So without further ado, we will go ahead and get started.
Good afternoon. My name is Mary Catherine Haver. I go by Mary Kate. I am currently the medical librarian at Moffitt Cancer Center and Research Institute Biomedical Library. I have experience in consumer health and also medical library information. The FHSLA TBLC collaboration is actually the end product of what had begun through the Medical Library Association and collaboration with the Public Library Association of connecting librarians with colleagues. We are looking to promote sharing of information. We serve the same population of members, so we're just answering slightly different questions, but there can be overlap. So we reached out to TBLC, and through conversations we've been able to come to an agreement for providing an exchange of knowledge and sharing our experiences. We'd like to encourage networking amongst our members and our organizations, and working together, we'd like to create opportunities for projects. Currently, this is our inaugural webinar, so thank you for attending. We will be covering COVID-19 topics today. Beginning in June 2020, tentative start date is the second Wednesday of the month. We are targeting the 12 to 1 p.m. time period because that tends to be work around lunch and might provide uninterrupted time to listen to webinars and participate. We are developing a list of high interest health topics. We also are interested in promoting any health awareness resources. So if you have any suggestions, please contact us. We will be more than happy to incorporate those throughout the presentations. We also, Jorge Perez and I had actually worked with Tony Wynn from the National Networks of Library of Medicine, Southeastern Atlantic region, for a session we did in 2018. So we would like to be able to work with the National Networks of Library of Medicine to add components to these monthly presentations, because there are so many freely available resources, but like everyone, we are all experiencing information overload. So FHSLA's intent is that we will have a list of key people that can be your initial contact if you need something quickly, and I need it on, cancer, or I need it on a autism, any kind of topics. So we will have people throughout our membership throughout the state that would be a local contact for any of you to reach out to, and you can just ask, hey, I need a free resource on this topic. Do you have any suggestions? And we will be more than happy to direct you to what resources we know are available. So These sessions are open to all FHSLA members and TBLC members. The sessions will be recorded and available through both organizations. And actually, so now our first session will be surveillance tools with Angela Novak. She's a medical librarian at Tampa General Hospital. So Angie, whenever you're ready.
Thanks, Mary Kate. Can you all hear me? Okay, good, thank you. All right, so today I'm going to talk a little bit about surveillance tools. I've pulled together some of my favorite resources to monitor the spread of COVID-19 on a global, national, and local scale. So with these tools, I think it's really important that we have the ability to find data about the virus. And when I talk about surveillance tools, I am referring to websites that we as information professionals and members of the community can use to track the spread of the virus, as well as testing and other health data. So like I said, I am going to look at surveillance tools on the global, national, and local level. And just to note that some of the sites are going to be a little bit more data-driven and technical in nature. All right, so first I wanted to talk about the numbers on a global scale. And while the tools that I'm going to talk about next can be used to monitor the virus around the world, they can also be used to track the spread nationally as well. So it's going to also be useful for national when we talk about these global tools. So this first one on the screen, Johns Hopkins University. This one I've come to know as kind of the gold standard of global tracking for COVID-19 since kind of the beginning of the outbreak. And this tool is used by a lot of different scientists, news organizations, and professionals when they want to actually view the data and the numbers. So some really great features of the Johns Hopkins dashboard include global statistics. On the left-hand side, you can see the count by each country, and the screenshot is a couple weeks old, so obviously we've had some increases since then. You can select any one of those countries and it will give you a more detailed view of that country depending on how they report their numbers. On the right-hand side, you can also see the total number of deaths and tested in the US as well. So you'll also notice in the middle section, you have a kind of a dot visualization. So this is a really great visual representation of the cases by each country. So even just visually, it is a great tool to learn more about the spread of the virus. And as far as public using this, this data, I think it's really one of the more easier sites to use to understand both visually and through the ease of use. There we go. All right. So
sorry, technical difficulties.
That's okay. Thank you.
Operator error.
All right. So the next tool that I wanted to talk about global surveillance is the University of Virginia COVID-19 surveillance dashboard. And I like to talk about both of these dashboards because even though they provide some of the same information, the data is presented in different ways. So some unique features of the University of Virginia dashboard is that you will see on the left-hand side a charted daily count for all regions. And you can view that cumulatively or daily. And it can be customized to report only what you want the graph to report. There is also a time slider right above the map there. So you can use that time slider to visually see how the virus has progressed through its history, which I think is really cool. And instead of that bubble map, like Johns Hopkins has, you have a color-coded map, which in some cases can be a little bit easier to read. So if you really like, it just depends on your preference on how you like to view the data. This is another really great resource to kind of see everything overall.
Sorry.
Oh. Mm.
Oops.
There we go. All right.
Okay.
So moving on to national surveillance, I have chosen a couple of tools that have a broader range of usability as they focus more on statistics in the community. But remember, if you are looking for just numbers, data about the numbers, you can also view that on the global dashboard. So the first tool that I included here is the CDC Weekly Surveillance Report. And this is a really cool tool because it is a very thorough information resource. You can read the information through the web page. They also have a PDF download that you can use as well. And some highlights of the weekly surveillance reports is that it summarizes and interprets key indicators like hospitalizations and mortality. You'll also be able to find information on laboratory data as well and surveillance information on those key indicators. So you'll really get a better in-depth view of the demographics of particular patients that are affected by the virus. Now, if you do want to get daily information, they also have a daily report from the CDC, which I've included a link for that as well. I did choose to include the weekly report because it is a thorough resource and a great way to gather information on trends. All right, the next one I wanted to look at is the COVID-19 cases and demographics. And if you're looking for just straight up demographic information for COVID cases, this is a really good site for that, both visually and just by the numbers. So you are going to be able to find population data and demographics and case information for all 50 states. I've included Florida here. I do really like the visual representation of the data because it is easy to read for non-healthcare persons. So there is also another page that you can go to as well that gives even more data. I think if you go to the next, okay, that's okay. There we go. So the coronavirus planning report, it gives you even more information. Again, visually is just easy to recognize the numbers and really pull that data if you need it to. So I just really like the way this site works and looks to be able to see information. All right, so the last national tool that I wanted to talk about is the Unicast County by County Social Distancing Grade Map. And this is just a really interesting way to see how our local communities and how certain states have participated in social distancing activities. So it does have it separated by county. If you zoom in, you can see your specific county. And I do encourage you to take a look at this you know, after the presentation, because the map from just a couple weeks ago to today is very different. You could definitely see a lot more or a lot less social distancing occurring now than there was a couple weeks ago, which is the map that we have up now. So just another really cool tool that you can use to kind of see numbers on a national scale. All right, and then finally, I wanted to talk about Florida surveillance. So there are some really great tools to help the public see how the virus has impacted our own communities. And my favorite amongst the Florida tools is definitely going to be the Florida Department of Health. They've done a really good job of creating this dashboard where you can see information like the total number of cases, hospitalizations, deaths on a county by county basis. You'll also be able to see statistics when you look at each county, and the map itself is color coded. So it's very easy to read, very easy to understand the information that you'll see here. And one really great feature is the testing data that is available through this site. So there's a ton of data on testing, like how many tests have been performed, whether they were positive or negative. All the data is county specific and also includes a cases by zip code section as well. So there's just a lot of information here that's relevant to us here in Florida, and we can also see our county data as well. So this is one site that I would definitely recommend to any member of the public looking for a reliable source to be able to track Florida cases. And it's easy to understand and read. So here's just a couple other pages. You'll see this one is the sort of bubble chart per county for testing on this one. We also have some other tabs at the bottom that will show you things like cases by county and cases by zip code as well. All right, and we have some demographics, so age distribution, and then you'll see that's the color-coded map. You can see it has very specific information when you click on each county. All right, so another great local tool is the USF COVID-19 Hub. So this is another really good tool where you can find total cases, hospitalizations, and deaths, as well as individual county virus statistics. So there is a dot visualization that is similar to the Johns Hopkins map that you'll find where you'll also find testing data as well through that map. So I really like that USF included links to health resources like the CDC, World Health Organization, and Florida Department of Health as well. So everything is really kind of a one-stop shop here. All right, and then the last one I like to point out is the Florida Disaster website. And this one is a nice tool that features daily reports, which is really, a really main feature of the site. So the daily reports that are included here contain testing information like cases and lab testing over time, number of tested per day, characteristics of resident cases. It includes a county breakdown of each element in the report, cases by area, surveillance information. They've got links to the Florida Department of Education, Agriculture, CDC, and tax relief. So you can see there is just a plethora of data that you can access here, and every day the report gets updated. If we were to actually look at that report, it's, I want to say 500 to 700 pages, so it's really a lot of data that's included in there, but it's a lot of useful data, and you can look at specific counties if that's what you're looking for in that report. So that's another one where it's just a content-rich place that you can find information for surveillance. And that's all I had for surveillance tools.
Our next presenter is Artis Hansen. She's with the University of South Florida Schimberg Library. Please welcome Artis, then she'll give you all her credentials.
I don't know about all my credentials. I'm at the USF Health Libraries, as we now have the more sunny downtown location as well. We have a additional library in the new building. So anyway, I'm the Assistant Director for Research and Education, and I spent 25 years in behavioral health before moving to the more focused health side of the street. So I wanted to talk a little bit about mental health and some of the resources and some of the frames around mental health, since we're in a unique situation being in a quarantine lockdown, stay at home kind of thing. So maintaining your mental health is very different and unique for us because this is a unique situation for those of us contemporaneously. And disclaimer, this is not meant to be medical advice or to substitute for that. It's just to say these are resources and things to think about to assess your own state or state of others around you, and how you might be able to decide where to go for more information. So mental health looks at many things rather than just a specific DSM diagnosis. We're looking at emotional, states, psychological states, and our social well-being. And all these factors affect how we think, how we walk, how we feel, how we act. And by definition, anything that's a pandemic or a disease outbreak is extremely stressful. Unless you've been quarantined because you had a C. diff infection or you had a major infectious disease and were hospitalized in quarantine, the level of fear and anxiety that you have, even if you're not affected directly, increases your everyday stress. So you have spikes in your cortisol level, et cetera, and everything can become magnified to the point where it may be essentially a situation that's very difficult to cope. And people with disabilities are especially vulnerable at this time because not only do persons with disabilities, and I'm going to speak specifically around persons who have behavioral health disorders, is that they already have more complex health conditions and situations. They receive a number of school or community-based supports. We have supported education. We have all kinds of built-in things set up within these community settings to support them to be able to be effective. They may have direct care staff, particularly persons who have mobility limitations, so they can continue on with activities of daily living. And oftentimes they may live in congregate settings where your exposure risk is far greater. And that is also very problematic. So within a community, it's not just those of us who are So we're looking at many types of different common reactions. I know we've heard about these and seen these on all different kinds of media, but you have changes in your eating and sleeping patterns. You have difficulty sleeping. One of the things that many of us find working remotely all day long is that sometimes you hit a wall in the afternoon and it's hard to push through it. If you have a chronic health condition, you may have a worsening of that condition because you no longer have easy access to your physician or to your health care provider. The same with mental health conditions, because again, you have stress and anxiety playing on you, and those things interact with already existing health conditions, health or mental health. People make jokes about the increased amount of drinking that people are doing now down in quarantine. Well, it's funny when it's a meme. It's not so funny when it becomes your way of getting through your everyday work. And people, again, have increased fear and concern about their health and the health of others around them. For children, and this is particularly important for children because they're in unique settings, even more so to them. They don't have the coping skills we may have as adults. So there's a whole series of behaviors that children and adolescents may evince, and which may also manifest themselves in some kind of emotional or psychological response, or even physical responses, because stress, as we know, does play a role in exacerbating physical conditions. And I think that's very important. The CDC Coronavirus Coping Managing Stress and Anxiety page is an excellent resource to look at just triggers or things you might want to be concerned about if you're worried about someone remotely or someone who is living with you, or if you're being asked questions about child and adolescent behavior changes, those kinds of things. So healthy responses in stress and unimaginable times is to really look at limiting the amount of news and social media. I quit watching the news about 8 weeks ago. I get my updates occasionally from BBC. Other than that, I don't care. If I need anything to know, my mother will tell me. Social media, I zip right past people who are the gloom and doom people are posting a lot of misinformation. I just block them temporarily because I don't want to see it on my feeds. A really good response is to focus on prevention, and that's usually a behavioral type of thing. So avoiding bad news mongers and those kinds of things, or very pessimistic or misinformation that's coming in is really important. It's good to have behavior set up where you keep your routines going as much as you can. So you make sure you get enough sleep. You build in exercise. Yes, it's harder to walk at home rather than having a gym, but it's still important to go for a walk or walk around your yard or walk around your house or do yoga, meditation, and to really maintain how you normally would eat, healthy, balanced meals. limit alcohol and drugs, and model those behavior for the kids. If you're going to sit there and be a couch potato and snack food time and just kind of hermit yourself in, kids are going to say, oh, it's okay for me to just sit there and eat, snacks all day long and play video games. Coffee and energy drinks, you should limit those because those are going to up your levels of response physiologically and are probably going to exacerbate any stress or anxiety you may have. If you know there are certain things that stress you, replace them with something else or just get them out of your life. Limiting news is how I'm handling this. Everyone is on edge, whether you're doing trainings or consultations online, on chat, having to go out and pick up food or anything, or just everyday responses. Everyone's a little bit edgier now. So just take a breath and step back. Build in time to unwind, particularly important, working remotely, online, 8 hours a day. I have 6 hours a day, pretty much, that I'm on social media. Teams, I'm on Teams, 6 hours a day between consultations and meetings. I try to block out 2 blocks in the day so I don't have anything scheduled, because otherwise my brain goes into mindset. And try to connect with your friends and your family. And even with all these healthy responses you may be engaging in, if you continue to feel really overwhelmed, you're unable to have a steady sleep pattern or anything else like that after a period of weeks, you should seek help from a mental health professional. So there are a number of resources you can have to seek out help. Mental Health America and NAMI, nationally known. There are chapters and support groups that they have in almost every state. On their website, you can go and you can find where these support groups are located. Almost all of them have some kind of interactive component, so you can email them. Some of them may actually have chats. They have actually put out some very good resource tips on COVID-19 and managing it and handling it. I recommend those because these are the experts who their entire life is mental health. Disability Rights Florida is also an essential resource. As I mentioned earlier, persons with disabilities have a more difficult time being engaged or maintaining daily functioning because of the number of supports they may receive. They may be home-based or community-based. Also, access to certain types of things may be greatly diminished. If there's a question about services provision, disability rights is the place I would go first and foremost if I feel I need someone to help me deal with resolving an issue or lack of services that I've received. So this is a very good source. And Project Return is an incredible resource right here in Hillsborough County. They do a lot of, it's a peer support center. There's a lot of peer counseling, a lot of peer discussions and resources, and they have a wonderful website where they post all kinds of happy, uplifting kinds of tips and reminders that if you're having difficulty to reach out. So these are community-based resources that I find extremely useful and very, very helpful. And the people, should you be contacting someone directly in any of these organizations, either by chat or by phone or by email, are very helpful and responsive. Another set I'm going to talk about is another great support group, the Depression and Bipolar Support Alliance, as an example, because just like Project Return and the DBSPA, they deal specifically with specific types of disorders. And so if you are bipolar or you have any form of depression, they will also provide information about local resources and or direct you to either a peer counselor or to a mental health professional with whom you can work. And I'm going to make a plug here for the federal resources. NIMH, wonderful thing about shareable resources for coping with COVID. The SAMHSA and NIDA and the Center on Addiction. SAMHSA and NIDA have directories for resources within states and within communities. Stress the national helplines, because if you have a question or if you don't know how to get help, the helplines are wonderful things to have. And these are wonderful resources and tools to be able to have available. And the Center on Addiction, I particularly like because they also have a strong focus on persons who are caregivers, as also does MHA and NAMI. So these are the kinds of resources that are my first points of contact when I'm looking for information, whether I'm doing a referral or trying to pull together something to give to another group. So just again, mental health is very important. And even though it's easy to say, I'm fine, questions you may get, particularly from your users and patrons, may come back and say, well, I'm not really sure what to do next. And I was okay, but now I have a problem and I'm not sure how to reach out because I no longer have a permanent case manager or something like that. These are the resources I would go to. So thank you.
Thank you, Artis. We will move on to our next section, if this slide will advance. Our next presenter is Jorge Perez. He's at the Florida International University in Fort Lauderdale. I might be on the location. Sorry,
Miami.
Sorry.
It's okay.
I get confused on that section. Sorry. And he's actually going to discuss some Hispanic and Latino resources for families and patrons.
So I'm going to go ahead and share my screen. And again, I'm Jorge Perez. I am a librarian at Florida International University. I did find a wonderful article, and it is from last month, April 8th. But the New York Times, there was an article that was published, and the title is Black and Latinos in New York City are twice as likely to die from coronavirus. So I know these are New York death rates and contamination rates, but the trend is nationwide. So Hispanics, 22 people out of 100,000 have died from coronavirus. This is in April. Blacks, 20 people per 100,000. Whites, 10 per 100,000. And Asians, 8 per 100,000. So the Hispanic and the Black community are very susceptible, and the article goes into why these are, why this trend is going on. Again, Latinos represent 34% of COVID-19 related deaths in New York, and it's 29% of the New York population. Blacks represent 28% of COVID-19 related deaths, and they represent 22% of the New York population. So you can see that these communities are hardly hit. And one example in the article is, for example, in Chicago, 72% of the COVID-19 related deaths are from Blacks. So the article mentions a lot of the reasons why. Of course, economic inequality. So poor people tend to not have health insurance and do not treat their health symptoms or chronic diseases. There's less access to healthcare. There's not accessible rapid testing sites or testing sites for COVID. This was happening, and hopefully it's not happening now, but there weren't available beds. So usually folks who went to the emergency room or some other care facility would be told to go back home because they did not have space in their institution. In the beginning, a lot of the healthcare workers did not have personal protection, so there was a lot of contamination. And of course, Blacks and Hispanic are frontline workers. They are bus and train drivers. They're working in the grocery clerks. They're janitors, childcare staff. So this makes them more susceptible to COVID. They have to go to work. and we're seeing this now. And some people may avoid the emergency room visits because even if they're contaminated, they don't want to go to the hospital. And this might be because of many reasons, maybe because of the anti-immigration rhetoric that's going on right now in our nation. But also, people want to stay at home. They'd rather stay at home, but the sad thing is that there's many more deaths because of the chronic diseases and staying at home with the coronavirus. So that's happening a lot. There are many more deaths. The other thing is something that the mayor added was 311 healthcare workers that speak Spanish. So that was a change that was made eventually, but someone who has issues with the language, the English language, may have issues getting some information. So a link to this guide will be available in the PowerPoint that will be as part of this presentation, and I just mentioned the article. Also, the two major media outlets, TV media outlets, are Telemundo and Univision, and I found that this has been very helpful because just like in English media, stars or actors or actresses have been talking about their experience with coronavirus. Some stars have even had multiple COVID contamination. So these have been very helpful. This, I kind of added it for fun. In Spain, there's an 80s song called Resistiré, which translated kind of means I will survive in a way, or I'm going to get through this. So at 3 o'clock or some time when people from Spain were in quarantine, they would all come out from the balconies and they would sing this old song. So it got so popular that a group of young singers created a new version of the song. So I thought that was kind of fun and interesting. But I do want to share a few resources that are linked in this guide. The first thing is the Food and Drug Administration has a wonderful video on when shopping, how to take care of making sure you don't get contaminated. We don't have money for Instacart or any of these delivery services. The fees are kind of high, so yeah, so most people have to go to the grocery store. The other thing I wanted to mention was that it's very important to let your community members know that, for example, I don't know if this is statewide, but here in Miami-Dade County, Tuesdays and Thursdays are 55 and older. They get to go to the store an hour earlier. So the grocery store, they get to have an hour for themselves. The store is clean, the store opens, and it's only for the older crowd, which is very important to let your patrons know about that. The first thing, one of the resources, Nora Franco has done a great job of collecting really important CDC, Centers for Disease Control, Spanish resources. I do want to quickly mention two of the resources. One of the ones I liked was how to disinfect and clean your house effectively. So I won't go over that, but it goes over a list of things to do for that. And also posters and videos. There are videos that you can embed and share, which is how to wash your hands effectively in Spanish. The posters are really good, and I'll continue to share these. For those of you who have the children's area in the library, there's some really fun posters that you can change to Spanish, and they're in PDF, and you can print them, of course. There's some more here. and some for adults, and they're available in Spanish. And of course, Keep Calm and Wash Your Hands is available in many languages, depending on the groups in your community. So this is kind of fun, and I'll share some of these, more of these. The other thing is the Medical Library Association. The Medical Library Association has kind of these groups called caucuses, and there's one called the Latinx Caucus, and they have an open Google spreadsheet with a lot of great resources. I do want to mention that not only is there general information on COVID in Spanish, there are for kids and parents, so they have done a lot of the work for us. Mental health resources in Spanish, and health and immigration. And also, I do want to mention that they also have state-by-state wonderful resources in Spanish. So this is a great resource that's linked in the guide. Thank you to the Latinx Caucus. And just want to mention that the CDC has, depending on the language that you're looking for, posters or flyers that you can give to your community members, depending on the minority group that's part of your community. I do want to mention a resource, COVID-19 Health Literacy Project, that's headed by the Harvard Health Publishing Group, and all these resources have been vetted by physicians. So if you click here on Get Fact Sheets, you have a whole bunch of languages, and of course Spanish is included, but these are great resources that you can download. So for kids, adolescents, women who are pregnant, and some other resources. So this is a great resource. It's called COVID-19 Health Literacy Project. WebMD is a wonderful resource for consumer health information, and they do have a landing page for coronavirus in Spanish, and you'll find some really good resources that are very helpful. So one that I thought was original was there was the rumor that cats can get COVID, and I don't even know myself if they do or they do not, but this is one of the pages if your pet can get COVID. So there's a lot of information. WebMD is wonderful. And also, there's a lot of questions from your community members about the stimulus check. The Social Security Administration has a wonderful page in Spanish, and also the IRS has a lot of information in Spanish, and I have those landing pages in the guide. And as I mentioned, I think I went over this, yes, and there was another poster, but pretty much, and I think we went through this, but I have more links on posters and more links on specific information for Spanish-speaking, for the Spanish-speaking community. All right.
Thank you, Jorge. And if we can, let's get stop sharing your screen, and we'll see if I can share mine. We'll move on to our next section.
So Mary Kate, just take over. You go ahead and share your screen.
Okay. That's great. their return to work policy is going to be, and how to start bringing employees back if they have been considered non-essential, and how to safely incorporate everyone back on site. Tara Brigham is the current president, immediate past president of the Florida Health Sciences Library Association. I just completed my term in early May. She and I were going to present on this. I'm not sure if she's made it yet, so I'll go ahead and move forward. Of course, the Centers for Disease Control and Prevention, excellent resource for guidance on community and businesses. There's actually, through the Arizona State Library Archives, there's a phased reopening for libraries, which are specific to our field. They include restrictions as the restrictions are lifted, guidelines for opening up, also how to manage the process and what you need to actually be aware. They have a section on reopening guidance for cleaning and disinfecting public spaces, workplaces, and businesses. So you do want to check their site. We have noticed that these types of resources are becoming more readily available. Tara shared a link to the Orange County library system. They have begun phased reopening. The really important thing is to have a plan, not to just sort of wing it and say, oh, well, we'll start this way and we'll work our way through it. It's really important to have an established guidelines. Some institutions are looking at a flexible work schedule where they'll, especially if have a number of employees in a department, that they'll stagger on-site work days, and everyone will alternate so that we can maintain that safe distance of 6 feet, because we really want to ensure not our community and our patrons' health. For many of our colleagues through FHSLA, we work in the health sciences, so we may be working with patients and their families, so we do want to exercise the maximum care possible. Let's see, Orange County has, and we'll provide this link, they actually have a service level breakdown, service level 1, what dates they'll be implementing resources, their preparation, and then service level 2 is they open selected locations for essential services. They have a date breakdown, what preparations are involved, and then their service level 3 remaining opening branch locations for essential services. So they actually step through, they have actually a total of 6 levels of service. The 6th is going to be full-scale library services, returning back to what we could consider now as a new normal. So these resources are available. We will make sure we provide them, links to them through this presentation, but also they'll be available through the Florida Health Sciences Library Association site. And we would like to we look forward to working with all librarians and library staff throughout the state to enable that we can hopefully manage this as best as possible. It's an unprecedented situation. No one has actually gone through this before, so we are all learning as we go, but we do want to make sure we maintain, we try to maximize safety for everyone. At this time, we'd like to open up the chat so that anyone that has any questions, we'd be more than happy if you would post your questions. Let's see. And
Harry Kate, this is
Yes.
Tara. I
Hi.
did post the link to
Okay,
Orange
thanks.
County opening guide. I will just mention that at Mayo Clinic, our library system actually stretches across 4 states. So that has been a little bit of an interesting situation considering we have to adapt to every state mandate since it's not national. And I will say that honestly, thank you to Orange County because their plan is the most detailed reopening or phased plan that we have seen. And like I said, we have a group of librarians that are been tasked with looking at reopening our libraries for our students when they start in July, but we understand that most of our public library colleagues are already kind of back in the action. And so we appreciate, you know, seeing what you.
Tara, I think you might have dropped out.
All are doing. Kind of looking at the public libraries. Oh,
Tara, we lost connection with you, so
that's fine.
okay. So if you could restate what you had just previously.
Oh, sure. Just
So,
just thank you to the public library colleagues, honestly, because you guys are already kind of back doing things where I will say for our library system, we are not doing that necessarily. So thank you for any guidance or, you know, plans that you have already put out. It's been very helpful for us with our trying to kind of consider our reopening and our phased opening.
so at this time, we would like to open for any questions or comments. Please post your questions in the chat. We'll be more than happy to have, you know, if it's specific on one of the topics presented, the presenter will be sure to respond. And, you know, if by chance it's a more involved question, we'll be happy to research it and contact you off after the presentation to follow up and give you more details. Any questions, comments? If there's sites that you've found you think would be helpful, we would be more than happy to share those with everyone too. And just as a follow-up, we are planning to continue these webinars on a monthly basis. So we will be able to offer specific topics. You know, I've worked in at least 2 different types of hospitals, so we have the ability to provide information based on, you know, specific patient populations like pediatrics, cancer, and other. So we would be more than happy to, if you feel there's a specific need, we would be happy to present and organize a webinar for that content. Because an example I recall is when, especially for congenital heart defects, conditions, there at one point, and this was well over 10 years ago, there wasn't a lot of information available, and then within 6 months there was a phenomenal site. So it's really nice to be able to connect with someone who's specializing in that area, and they can connect you to the freely accessible resources.
We got a question from Emily. Is there any chance some of these resources will be captured in another format? We're going to be sending out the slides from this presentation so that then you'll be able to click on everything, because that was a wealth of information. So there was a lot there. Oh my God, thank you guys so much, because I used a lot of those. I actually just updated our COVID resources page with some of those links. So, and then, oh, Jules just commented with the NIH, is that National Institute of Health?
Yes.
Okay, with their coronavirus
Mhm.
guidelines. Thank you, Jules.
And there are opportunities because Tony Wynn is on the webinar. He's actually the director for the National Networks of Library Medicine. There are many freely accessible online courses that you can take that focus on either specific conditions or patient populations. These are highly valuable. It's a great way to participate in continuing education, and they will highlight specific resources, also developing a search strategy for locating information. So we will be more than happy to share that that link too. I will get that to you after the presentation. If you ever have any questions, we're more than happy to answer any questions. You can contact Tara, myself, or anyone through the FHSLA listserv website. We actually, and depending on where you are in the state, they may call it FHSLA north of I-4. So Northern Florida calls it FHSLA, and we tends to be south of I-4. We call it FHSLA. So
That is so interesting.
I can't explain it. It just is that way. So
Oh, thanks, Tony. He said, happy to help out.
yeah, and you know, they have the National Networks of Library Medicine have staff that, you know, we will be more than happy to invite to participate, you know, with us, because we do want to establish and maintain a collaboration throughout the state so that it benefits all and isn't limited to just a specific area. So.
Nice. Cool. We'll stay on for the last few minutes if anybody has any last minute questions. But yeah, I can't thank you all enough. That was wonderful.
Well, thank you, and we're looking forward to working with you. You know, this is a phenomenal opportunity. So.
Yes, and to all the participants, as it was mentioned earlier, if you have any ideas for future topics for these, you can email me or Mary Kate. We'd love to hear from you. Oh, Emily said, where can we sign up for the next one? We'll send out the information because it's not on the calendar yet, but once it is, we will send out the link and you can register that way.
And we tentatively think it'll be Wednesday, the second Wednesday of the month, but there might be some modification, but we'll be sure to get the information out earlier than we did for this specific.
Yes, it's been a crazy month, so thank you all for bearing with us.
And we appreciate everyone's patience. So.
All right, everybody. Well, thank you so much. We'll wrap it up, and yeah, stay tuned for info on the next sessions.
Great. Everyone have a wonderful afternoon.
Thank you.